So guys, I have here a left shoulder of a 48-year-old female patient who says she has some kind of pain due to a trauma event. So let me share the screen with you guys so we can enjoy the images as much as I. So this is a shoulder scan, an MRI, we have PD with fat saturation, and we have T1 images. So we use T1 images for morphology, and we use PD fat saturated images to look for pathology. So morphology on this and pathology on this. So you guys can see this is a obese patient. She was in very much pain. She couldn't hold still. So we have a lot of motion artifacts, which is very bad, but I guess we can make diagnosis, very useful diagnosis from these images. We don't have to send this image back to the clinic. We are going to report it and we are going to make sense of this very poorly done exam. So we have a case of painful shoulder of a middle-aged woman. So let's see if we can find any signs of trauma. Okay, so what am I looking for to say this is trauma? I have to look for fractures, for bone edema, and most commonly on shoulder scans I have to look for signs of anterior or posterior shoulder dislocations. So let's roll the sagittal view, no bone edema. If I roll the T1, there are no fractures to be seen. Right there, no fractures. If I roll the axial view, this is awful. Let me get the other one. Yeah, right there. This is as bad as the last one, maybe even worse. But right here on the posterior, lateral and posterior, posterolateral view portion of the humeral head, we should have a depression, a deformity, which we don't have here, if this patient had suffered a anterior dislocation. So I see no signs of anterior dislocation, and there is a anterior and medial depression quite about here when a patient suffers a posterior dislocation. So I have no signs of posterior nor anterior dislocations, no signs of fractures nor bone contusions, bone edema. So I can't really tell this patient has suffered any kind of major trauma that could be a reason, a justification, a motive for having a painful shoulder. So this isn't related to trauma as much as I can tell by just looking at these images. Right here, right there. Yeah. Let's just now look for stuff we can say for sure this patient has. This patient has arthrosis, osteoarthrosis of the acromioclavicular joint. There is all those common signs of degenerative disease. There is narrowing of the joint space, there is sclerosis, and there are osteophytes on the margins of the joint. Also, I have bone edema, and I have some kind of thickening of the capsular elements, the elements of the capsule of the joint. So we have a bone edema, arthrosis, and synovitis of the acromioclavicular joint. This by itself could be a motive for a painful shoulder. So this is painful on itself. It could be enough, just this. But we can go further, we can look for other signs, other common signs of a painful shoulder. Right here I have a sagittal view. I can see with ease that right below the acromion I have a distended fluid-filled subacromial bursa. So this is a subacromial subdeltoid bursitis right here. So there is shoulder bursitis right there. Also very much common, we have a altered supraspinatus tendon right there and right there. So this tendon is blurred, is heterogeneous, and has a slight hyper-intense signal if compared to the other tendons right there. So I have a very homogeneous and dark infraspinatus, teres minor and subscapularis tendon, and the supraspinatus is kind of inflamed, so this is a tendinitis. We have bursitis, osteoarthrosis, and tendinitis. All of those are painful causes, very common causes of pain on the shoulder. So also we have to say if there is some kind of hypertrophy of the muscles, and yes, there is a supraspinatus hypertrophy, a infraspinatus, and a teres minor hypertrophy. So most of the shoulder muscles are hypertrophied, are chronic, are suffering of chronic, some kind of chronic impairment, usually related to pain, to chronic pain. So I have muscle hypertrophy. Also, I am obligated to look for fibrocartilaginous tears, glenoid labrum tears. This is a very difficult thing to assess in this particular exam because, of course, you guys know fibrocartilage is a very difficult feature to analyze, even when we have a very good looking exam, a very well done exam. In this case, this is an old machine, the patient is in a lot of pain, it's all shaky, it's field of view. This exam was made with a very large field of view, which reduces the overall resolution of the images, and it's really difficult to be sure about a fibrocartilaginous tear in this case. But I can say, if you guys bear with me, I can say right here on the anterior and superior portion of the glenoid labrum, it seems there is a tear right here, and it just happens this is the most common site of such lesion. So I can quite securely, I almost can almost be certain that this is a tear of the labrum of the glenoid labrum right there. So let's just summarize what we just saw. We have arthrosis and synovitis of the acromioclavicular joint. We have subdeltoid subacromial bursitis. We have tendinitis of the supraspinatus tendon. We have a rupture of the glenoid labrum, and we have chronic pain of the shoulder because most of the muscles are hypertrophied. So we have suffering, chronic suffering, arthrosis, tendinitis, bursitis, and fibrocartilaginous tears. So this is a major painful, a very chronic painful shoulder. So if you guys enjoyed this video, I'm pretty sure you're gonna enjoy this one right here. Just click here and keep watching. And of course, hit that like button, consider subscribing to the channel, and I'll see you in the next video. So long.